Hi, I'm Dr. Russell Faust, Oakland County Medical Director. I'm here with an update on COVID-19. Now, the state's COVID-19 vaccine dashboard tells us that 861,644 Oakland County residents 12 years and older have been vaccinated with at least their first dose. This takes us up to 78.9% vaccine coverage for that group. 37,310 children ages 5 to 11 have received their first dose of the vaccine. So this is wonderful news. We continue to be at a high transmission rate based on CDC's level of community transmission tracker. Oakland County's 7-day case average for confirmed COVID-19 cases is about 2,200 cases per day as of January 18th. Too high. A lot has changed in the last month with the emergence of the Omicron variant. In January, the CDC updated their isolation and quarantine guidelines, causing a lot of confusion. So we're going to break down those new guidelines for you. Whatever your vaccination status is, it is now recommended that people who test positive for COVID-19 isolate themselves at home for at least 5 days. If you have no symptoms or your symptoms are resolving after 5 days, you can leave home but continue to wear a mask around others. If you develop a fever, continue to stay home until your fever resolves. Now, regarding quarantine guidelines, those were isolation guidelines. Regarding quarantine guidelines, there are different steps to take based on whether you're up to date on your COVID-19 vaccines or not. So first, if you are a close contact of someone with COVID-19, but you have been boosted or completed the primary series of Pfizer or Moderna vaccine within the last 6 months, or you completed the primary series of J&J vaccine within the last 2 months, you need to wear your mask around others for at least 10 days. If possible, get tested about the 5th day after your exposure to see whether or not you've become infected. Now, if you fall into these following groups, you have a different set of quarantine guidelines. I know, it's confusing. If you have completed the primary series of Pfizer or Moderna vaccine more than 6 months ago and are not boosted, or you completed the primary series of J&J over 2 months ago and are not boosted, or you're simply unvaccinated, stay home for at least 5 days, get tested around day 5. If test results are negative and your symptoms are resolving, you can end isolation, but still continue to monitor yourself for symptoms and continue to wear a mask around others. If you absolutely cannot quarantine for those 10 days, you must continue to wear a mask around others. If you develop COVID-19 symptoms, whether you're boosted, vaccinated, or unvaccinated, get tested and stay home. Because Omicron is so easily transmitted, so easily spread, masking is now more important than ever, I should say. Wear a mask in public, indoor settings. Consider wearing one outdoors if you're in a crowded environment. The CDC recommends that you wear the most protective mask that you can access. High filtration masks like KN95s or N95s are a great option. If you don't have access to those, a surgical mask or a cloth mask is still effective. Make sure you have multiple layers though, and that it fits tightly to your face over your nose and mouth. This doesn't cut it. Avoid single-layer masks such as bandanas or gaiters. While they're convenient, they are much less effective. Now, at the beginning of January, the CDC also released new booster updates, stating that 12 to 15-year-olds should receive a booster shot 5 months after their primary series of Pfizer vaccine, not Moderna, not J&J. We continue to offer pediatric first, second, third, and booster doses of COVID-19 vaccine at our community clinics throughout the county. Everyone age 5 and older is eligible to receive COVID-19 vaccine. Visit our website, oaklandcountyvaccine.com, to find a clinic location that works best for you and your family. Those who do not have access to the internet, call our Nurse on Call hotline at 800-848-5533, Monday through Friday, 8:30 to 5 p.m. for more information. Thanks so much for listening. Have a great week. Stay safe.